This workshop is said to be very apt, coming against the backdrop of the much-dreaded Ebola disease, from which the sub-region is yet to recover. Liberia, which was grouped along with Nigeria in the training program, suffered a great deal from the Ebola disease, with 4,808 deaths recorded at the height of the epidemic. The latest being the death of a 17-year-old after the country was declared Ebola-free in May this year. So the presence of hierarchy of Liberian officials, including the Deputy Senate President, senators and ministers, explained their interest.
Remember, when Ebola struck, the president had to ask us to approve an emergency $5 million. $5 million that were not available anyway. So if you have an agent like this, and the law will be very clear, probably you will ensure that there's some money put in escrow that will be privy only to this institution.
Stakeholders agree that inadequate healthcare system in the country's worst hit was primarily the reason for the widespread.
The impact of recent Ebola virus disease crisis across part of West Africa and other pandemic diseases has led governments to appreciate that disaster management is a cross-cutting and real development issues.
Worrisome, however, is a new trend of Ebola that can be sexually transmitted.
Following that again, we are also seeing evidence that the virus could be transmitted from some domestic animals like dogs. So this happened there, but we are still investigating what.
The training, hosted by the ECOWAS along with the Kofi Annan International Peacekeeping Training Center and the Ghana Disaster Management Organization, was sponsored by the United States of Africa Command, with the U.S. government committing $30 million. So far, 8 out of the 15 ECOWAS countries have been trained. From Accra, Ghana, Cordelia Okwoma, NTA News.